Welcome back to HealthWise. With us is Dr. Mia Ben, and we were talking about summer ailments. And now we're going to talk about the dreaded summer colds, what everybody gets and can't get rid of.
Right.
And Doc, what are some of the things, I know you said something about parainfluenza. What exactly is that?
Okay, parainfluenza is actually a virus, and it's kind of related to the same family as the flu virus, because that's why they call it parainfluenza. And usually it's a virus that causes croup.
Okay.
Yeah, that's the one that usually causes croup. So if your kid has the barky cough that sounds like a seal or a sick dog, it more than likely they may have the parainfluenza. We see a little bit of it in the winter, but lately for the last few years we've been seeing peaks in the summer.
Okay.
So if a child has a little runny nose and that little barky, you might not get the barky cough or the croup like you get in the wintertime, but in the summertime you'll have that little naggy cough that kind of you just can't get rid of.
What is done for that? What do you
Basically supportive care. If the child's having croup-like symptoms, we can do steam in the bathroom, foggy, and it's already hot, and then you have to do the steam anyway, but it still helps. And I usually recommend lots of liquids that'll help soothe the throat so that the cough is not as bad.
Right. What about, when they get this cough, is it and I guess what I'm trying to say is it's not fatal or anything. It's something.
It depends on the child. Usually when we have the croup or the parainfluenza type deal going on, they'll have a little bit of respiratory distress. So some of the kids will need some type of breathing treatment. It just depends on how the child looks. If they just got a little naggy cough, probably something, in that case we need to check and make sure the child doesn't have what we call a secondary infection, which would be a sinus infection or an ear infection. Once we've ruled that out, then it's basically supportive care.
Okay. And then another one of the viruses that we talked about was rhinovirus.
Yeah, rhinovirus is the one that causes the common cold.
Okay.
But for some reason, it still hangs around in the summertime. But usually that one doesn't last as long. You can probably get rid of that type of cold in about 2 or 3 days.
Okay.
As opposed to the parainfluenza, that one might last a week.
Okay. And then the last one, we were talking about the adenovirus.
Adenovirus or adenovirus. That one's funny because it can cause a lot of things. It causes the colds. Okay. One thing it can cause too is what we call, it's a big thing, hemorrhagic cystitis. And if you ever see it or get it, you'll know it. Because what that is, you'll have a bloody type urine.
Oh, okay.
Yeah, and it'll be almost as red as your shirt.
Wow.
Right.
And I'm sure that's real scary for some of the parents if they see that and they see all of a sudden. I bet they panic and like what.
Right, right.
And why is that? Why?
It's just the nature of how the virus invades that part of the body, and then it causes blood flow more into the bladder.
Okay, so it's just more blood in the bladder. Okay. And what are some of the treatments? What would you do for
IV fluids and just supportive care.
Would you have to do hospitalization for that?
Every now and then. I haven't seen a case of it in about 3 or 4 years.
Wow.
So at that time, that person didn't require hospitalization.
But it was, but like I said, I bet it was scary for the parents.
Right.
They see that and it's just something that.
And the other thing that adenovirus can cause is the regular sore throat. And it'll be a viral sore throat, so you can't really use an antibiotic for it.
Right.
And how we usually figure out that they have that one usually comes, believe it or not, if you have pink eye and a sore throat at the same time, usually it's adenovirus.
Really? Okay.
Yeah.
So that's something that's some information the parents out there can use. But once again, I would suggest that if you do suspect that your child has any of these viruses or anything, the best thing to do is go to a pediatrician and get your child checked out. What's the ages that you see?
I see ages from birth to 19.
Right. So, if any of you have any problems, go see Dr. Mia Ben at her clinic. And Doc, you might want to tell everybody, we got about a minute left. Tell them what's your address and where you are.
920 North Main in Opelousas, and our phone number is 407-8697.
Okay. Well, Doc, it was a pleasure having you on the show. And It's always good to see you. And like I said, anytime you want to come back, feel free to come back and
Sounds good.
tell the audience some more about pediatric care in Opelousas. Thank you again for joining us, and we'll see you next week on HealthWise.